Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering the differences between avoidant personality disorder and dependent personality I can't speak. Personality disorder. So before we get started, guys, you're going to love the video. Go ahead and like this video now so you don't forget. Like this video, subscribe if you haven't done so already. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. And almost daily, you guys can catch me covering different types of nursing questions on my other social media platforms, such as TikTok. Where else am I on? I'm on TikTok, Instagram, and Facebook. There we go. All right, guys, let's get started. We're going to start with avoidant personality disorder. And both avoidant personality disorder and dependent personality disorder, these both fall under the C personality cluster, okay? These are your C personality types. Let's start with avoidant. Take a look. Let me make this a little bit bigger for you. Okay. So before I even get started, the patient with avoidant personality disorder, just like the name say, they avoid any situation that has the potential of bringing them stress. And when I say stress, I mean any form or feeling of rejection, of humiliation, of embarrassment. So what happens is, and think about it, anything you do, guys, potentially you can be rejected or you can have some type of humiliation or embarrassment. So this really limits their life. This really decreases the quality of their life because they're basically avoiding everyone and everything. And that's why it's called avoidant personality disorder. Look at what it says. It says people with avoidant personality disorder are extremely sensitive to rejection. They feel inadequate and they're socially inhibited. Notice the author could have just said that they're sensitive, but they put that adjective that's describing sensitive in front of it to bring that point home that more than normal, okay? They are very, very sensitive about these things. They avoid interpersonal contact due to fears of rejection and criticism. So they don't even get that human contact that we all long for because they're so afraid of being rejected or of being criticized. Let's keep going. Move this up for you. Okay. It's found equally in men and women. Excuse me. So it's not predominant in one sex. The main pathological personality traits are low self-esteem associated with functioning in social situations, feeling of inferiority compared with peers, and a reluctance to engage in unfamiliar activities involving new people. Let's break that down. Let's not just move past this. Because right now they're telling us the classic symptoms, the hallmark manifestations of somebody that has avoidant personality disorder. So let's look. They're going to have low self-esteem. And you have to have low self-esteem to avoid any type of human interaction because you're afraid of being rejected, that you're afraid of possibly being ridiculed or criticized, right? So they have low self-esteem associated with functioning in social situations. Feelings of inferiority, so they feel like they're not as good as everybody else that's around them. Reluctance to engage in, let me tell you right now, they are not willing to try anything new, especially in front of anyone. They're especially sensitive to and preoccupied with rejection. That is their biggest fear in the world. Rejection, humiliation, and failure. Not only that failure, that criticism that comes with the failure, they're afraid of. They often avoid new interpersonal relationships or activities due to their fears of criticism or disapproval. So let me make this clear. They want to have social interactions, but they're afraid to. Okay? Guidelines for nursing care. Remember that being pushed into social situations can cause severe anxiety for these patients. Don't push them. Provide the patient exercises to enhance new social skills. Look at this, but use with caution because any failure can increase feelings of poor self-worth. So what you want to do, a nursing intervention, is to give them an exercise that you know they'll be able to accomplish. You don't want to give them something that they even have a chance of failing at. Assertiveness training. Teach them how to be more assertive. Assertiveness training can assist the person to learn how to express their needs. Because remember, along with that decreased sense of self-esteem, right? They feel that they're not worthy, so they won't even want to verbalize their needs, because remember, they have low self-esteem, so they feel like they're not even worthy to want what they want. They're not even worthy to have what they see all their other peers having. So that's very important. Treatment. Individual and group therapy, always you're going to start off individual first, because remember, they're scared of social interaction. So you're going to have to ease them into group therapy, and you need to make sure the clients, the other patients that you have in the group therapy, that they're not the type that will sit there and ridicule this patient, because remember, this is their biggest fear. Psychotherapy, it focuses on trust and assertiveness training. Patient may be put on anti-anxiety medications because of all the anxiety that they're going to have towards this, that actually they already have towards social situations. Beta adrenergic receptor antagonists such as atenolol to decrease the autonomic nervous system hyperactivity. Along with that nervousness and that fear that they have is increased blood pressure, increased heart rate, right? And antidepressant medications. Remember, our first line of drugs for antidepressant are our SSRIs. Remember, depression is anger, resentment, hostility, turned towards who? Self. Okay? That is your avoidant personality disorder in a nutshell. That's the most important thing you guys need to know. Now, I encourage you to practice questions now on avoidant personality disorder. If you guys go to my mental health psych playlist, I have a couple of videos up on personality disorders where I cover different questions. I encourage you to watch those videos and practice answering questions on personality disorder. All right, let's move on to dependent personality disorder. So we talked about avoidant. Now we're talking about dependent. We're right down here. Dependent personality disorder is characterized by a pattern of submissive and clinging behavior related to an overwhelming need to be cared for. Do you know how annoying that is? Do you think this type of person will have romantic relationships that last long? No. Who wants to be with someone that has to be with them 24/7 a day, 24 hours in a day, right? So one of the things that we see in dependent personality disorder is a disruption of romantic relationships because a person is so needy. So remember, they have a pattern of clinging behavior, and it's overwhelming. They want to be cared for. This need results in intense fears of separation. Everybody needs some alone time, right? My husband took my son to soccer practice today, and I'm so happy because my niece went as well. So I'm here in the house by myself. I got the studio. I don't even have to put on the light for the studio. No one's here. I don't have to worry about anyone making noise after this video. I'm going to have me a glass of Moscato, light some candles, and just relax. It's my time, me time. Everyone needs me time. Imagine being with someone that you go to the restroom, they're right there at the door waiting for you. Kind of like having a toddler, right? But a grown adult. Not fun. All right, let's keep going. They have a high need to be taken care of. They may manipulate others to assume responsibilities for such activities as finances or child rearing. So what we see, people with a dependent personality disorder, will see them, they'll be like, oh, It's just too much for me. I can't do it. I can't take care of the kids. It's too much for me. I can't pay the bills. It's too much for me. I can't balance my checkbook. It's too much for me. You're so smart. You know how to do it. You take care of it. They may experience intense anxiety when left alone, even for a brief period of time. Nursing guidelines. Be aware that strong counter-transference may develop because of the patient's demands for extra time and crisis states. So let's talk about this word that we just saw, counter-transference. Remember, transference is the feeling that the patient has for you, the nurse, because you remind them of someone they either love or hated. And so whatever feelings they have for the person that you remind them of, they transfer those feelings onto you. Counter-transference is a feeling from you, the nurse, to that patient. So you got to be very careful, because remember, these patients are very needy and you can get annoyed very quickly. So you're going to have to watch that. The therapeutic nurse-patient relationship can provide a testing ground for increased assertiveness through role modeling and teaching of assertiveness skills. Treatment. Let's look at treatment. Psychotherapy is the treatment of choice. We love when we see this phrase. When you see treatment of choice, that means that is the number one thing that we like to use before anything else. Psychotherapy is a treatment of choice for dependent personality disorder. Cognitive behavioral therapy can help patients develop more healthy and accurate thinking by examining and challenging automatic thoughts that result in fearful behavior. So cognitive behavioral therapy, cognitive, how you think, behavior, how you act. So cognitive behavior therapy helps you change the way that you think and the way that you view situations and the way that you act on those situations. Other types of therapy, antidepressants. Because remember, antidepressants, anger, hostility, resentment, depression, is anger, hostility, resentment turned towards self. How come I'm so dependent? Anti-anxiety agents. Panic attacks can be helped with TCAs, tricyclic antidepressant, such as your tofranil. And guys, that is your dependent personality disorder in a nutshell. That's the difference between your avoidant and your dependent. On the next video, I want to get into pediatric cardiology, pathologies. I think that's going to be my next video, because I've been seeing in the comment section, a lot of you guys have been struggling with that. You guys definitely have to understand that, but I promise I have more psych coming your way. So if there's something in psych that you'd like to see me do a video on, go ahead, let me know in the comment section, or anything different. Let me know what you thought about this video. Let me know in the comment section what you'd like to see me cover. And don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. Thank you for watching this video, and you guys will catch me on the next video.